Good afternoon, everybody. I am going to do a screen share here and get us going. But seeing as we have um, the Brady Bunch view here, let me do some introductions and then I'll start my slides. My name is Lisa Salberg. I'm the founder and CEO of the Hypertrophic Cardiomyopathy Association, and I'll be acting in the capacity of moderator today. And I'm going to introduce you to some pretty amazing people, including Julie Russo, our legislative lead here at the Hypertrophic Cardiomyopathy Association, the amazing Allison Conklin, coming to us live from Pennsylvania with an amazing story. Noah, who's coming to us from Model Solutions, and he's going to talk to us about some legislative modeling that we can do in the state of Pennsylvania to improve the detection of those with genetic heart muscle disorders. And finally, Timothy Wong, good friend for many years from the University of Pittsburgh Medical Center out in Pittsburgh. And he's going to talk to us about some of the disease states that we're looking for. So over the next 30 minutes, and we've got this nailed down to a good tight 30 minutes, stick with us. We're going to take you on a little journey and hopefully you'll have a better understanding of what the problem is and how you can aid in its solution. So we are here today doing a legislative briefing in the state of Pennsylvania. So welcome, Pennsylvania. Pennsylvania, I got to give you a shout out. You're doing a pretty good job. We've got some things that we can work on to get even better, but congratulations, you're doing pretty well. So today you're going to hear from me about a little bit of an overview. Then you're going to hear from Dr. Wong about the diseases. I'm going to take it back to talk about the policy initiatives. You're going to hear the patient story. And then I'm going to take it out a little bit at the 30,000-foot level. And then you're going to hear from Noah on what you can do next. Who is the HCMA? We're a 501c3 founded in 1996. So we're approaching our 30th year of operation. We have sought to become the preeminent organization improving the lives of those with HCM and other thick heart muscle disorders while preventing untimely deaths and advancing global understanding. We do this through many programs. You can learn about more at 4hcm.org, and hopefully you can join us for some educational programming in the future. We've created a state-by-state report card, and congratulations to Pennsylvania. You've scored a B. It looks like a B minus up there, but you're actually a B. So congratulations. We would like to see you recognize HCM Awareness Day as the fourth Wednesday in February in perpetuity. This year you had too many resolution requests and we were declined. We hope that next year we can get Awareness Day in perpetuity so that we have an opportunity to focus attention on HCM at least once a year. Congratulations on your AED policies. You're doing a fantastic job. And we don't only want to ask you for things, we want to thank you for things. So your leadership in AED policies is something to be admired. Thank you. We do need to work on some copay accumulator laws and non-medical switching, which have to do with access. And then also the elements of our Healthy Cardiac Monitoring Act original work, now called the Children's Cardiac Safety Act, could be implemented in your state to identify children earlier and identify families earlier so that we can get to them with the appropriate therapies in an efficient manner. These are the states that have so far recognized HCM Awareness Day. No pressure, Pennsylvania, but that list is pretty long, and I think your name belongs right next to your friends in Jersey. So come on, let's get it done next time. Okay, we're going to pass along the microphone to our good friend, Dr. Wong, who comes to us from UPMC and is the incoming chapter president for ACC Western Pennsylvania, or governor, whatever I'm sorry if I used the wrong title. Tim, you can unmute yourself and the presentation is yours.
Lisa, it's been fantastic working with you. I think since 2010 when I dragged you over to Pittsburgh for a site visit.
Love it in Pittsburgh.
Excellent. So I think when we meet patients and we tell them that they have a cardiomyopathy, we often try to simplify things and really go over what the heart muscle does. It pumps blood. And that the size of the heart and how thick the walls are can often tell us how healthy or not healthy the heart is. And oftentimes when the muscle is a lot thicker than normal, this is what we call a genetic cause, meaning that something is running through family members, and it is one of the more common inherited heart disorders. And we estimate that about 1 in every 250 people have it. But because folks with mild or moderate disease may not always have symptoms, this is an underdiagnosed disease, meaning that probably only 1 in 10 patients actually even know that they have the disease and are following up regularly with their family and cardiologist care teams. While I mentioned that you can often be asymptomatic, there are also symptoms including heart failure, such as shortness of breath, filling up with fluid, or even having a bad heart rhythm that could make your heart stop all of a sudden. So I think at day's end, when we're starting to mention all of these diseases that can affect the heart from a genetic standpoint, we're dealing with things that can fundamentally change someone's life, whether there are symptoms present or not. Could you forward this next slide? Thank you. So this slide is really a numbers slide, and I find it very busy. So I like to often take a step back and really distill, cardiac medicine down to, it's all about caring for our communities. And, whether you live as part of a city block or you're living in a suburban development, if we estimate that there's several hundred people that you kind of say hi to and wave hi and ask, how are you doing? And everyone says fine. Within that community, there's 1 to 3 patients that may be sitting on heart disease and may not know that they have it. So when we, talk about this kind of alphabet soup, HCM, ARVC, LQTS, we're really referring to things that can significantly affect your heart. You may or may not know about it, and raising awareness and diagnosing these conditions as early as possible is really important. And just to show how diagnosing these conditions may not be simple, sometimes they can present with signs that your doctor can detect on an exam. Sometimes you may have symptoms like shortness of breath or palpitations or other symptoms, but often there are no symptoms, or these symptoms are so common that they're chalked up to other more benign causes. And having a systematic approach to really look for these and identify them early on and follow and treat these conditions can really help our patients, help our families, and fundamentally help the communities that we all live in. So with that, I'm going to turn it back over to Lisa to talk about some of the features of the act that we will talk about.
Absolutely. I did just want to take one quick second on this slide is to, some of you may be watching and wondering, well, why do I want to get there in time? We can do things to ease the burden of the disease in that individual patient and in fact, protect that patient, whether it be from sudden cardiac arrest through a defibrillator, through medical management, or for prevention methods for things like stroke. Even in the young, stroke is possible. So we want to make sure that we get there in time to intervene, to do the things needed to protect life and to keep families whole. And then we have the opportunity to screen the entire family. Once one individual is identified, then we can move ahead to the rest of the family and identify those individuals and get there in time. One of the consequences of not diagnosing somebody in time is the reality that they could suffer a sudden cardiac arrest out in public. And we know that the survival rate from sudden cardiac arrest outside of a hospital is very, very low. And there could be a neurologic issue as a result, a head injury or some other type of injury that then is on top of the underlying disease state itself. So we want to get there in time and identify families. So how do we want to do that? So you're already doing a really good job at student athlete pre-participation screenings. And there's a couple of things that we can add to that system that will make it an even stronger program. So we would encourage you to take a look at some of our model language, compare it, and there's some nuance changes that could be made there. But most importantly is taking that questionnaire to the next level, and that's bringing it to every well child examination. We know for fact that of all the children and young people under the age of 24 who die suddenly and unexpectedly from cardiac disease, 40% will have hypertrophic cardiomyopathy. Others will have other diseases that we can also catch in this safety net of screening for family heart health history questions. But we do it in the well child exam. Because if we look at all of the children who die under the age of 24, only 20% are athletes. So we're doing screening on 20% of those who are at risk. So why are we not opening it up to all children? So that is our challenge for Pennsylvania, is just take the same questions that are on the PPE related to cardiac component of screening and add them in the well child examination. And the parent can answer those questions so that they can have an informed conversation with their child's healthcare provider about the risks that run in that particular family. We want to improve the education model behind these programs to ensure that physicians know what they're looking for and where to make proper referrals. And again, you guys are doing a great job on AEDs, but maybe we can look at more organized community action planning, much like fire drills for cardiac emergencies. You guys are already ahead of the game. Why not take it up a notch? So what do we know about the key virtues of the Children's Cardiac Safety Act? It's bipartisan. No matter your political affiliation, you have a heart, and we care about all of them, and we want to protect them all. It's cost effective. We're being proactive as opposed to reactive. We know that the costly diagnostic procedures that can be associated with some of these possible diagnoses can be limited by identifying those who have highest risk, either by family history or symptom, for these screenings. If we can identify those children, we're saving those lives much earlier. We can avert the higher costs of treating the other injuries that could occur. We want to promote pediatric cardiac wellness overall for all children. We should be talking about this earlier. We should be making sure that they make smart eating choices and diet choices based on the future of their cardiac health, not only the moment. We know that this has worked in New Jersey. We're right across the river. We're not far away, but we've been doing these questions in our well child examinations for almost 10 years. Our diagnosis rate is up. Our rates of sudden cardiac arrest are down. Come join us. The weather's good over here. We've had this language vetted through the American Heart Association. They have some very vigorous standards for what they will endorse and what they'll get behind. They're supporting us here. It's not their primary legislative initiative for the year, but they're working with us to make it happen. So we're taking the lead as the smaller organization, but they're right there by our side. And we hope that we can improve the lives of those in Pennsylvania and identify children and families at risk. We also want to mention that the American Academy of Pediatrics put out a call to action for providing better screening for our children's hearts. They gave the call to action. We're giving you the tools to do it. Please consider this. Okay, now we are going to hear from Pennsylvania native Allison Conklin on her story with HCM. Allison, the stage is yours.
Hi, everybody. First of all, thank you to each of you for all that you do. And thank you for anyone who's watching and what you're doing to change things in Pennsylvania. I was a very athletic kid. When I was 13, it was a very competitive game of floor hockey, and I passed out in the middle of it. The nurse called my mother. My mother picked me up. She took me to her cardiologist. And after a few tests, I had been diagnosed with hypertrophic cardiomyopathy. The doctor was basically like, your heart is just like your mother's. And fast forward, I had no idea really what that meant, but suddenly I had a whole team of cardiologists. Fast forward 5 months, my mom and I were in the kitchen together. It was my first day at my very first job at a library. And she was cooking in the kitchen and all of a sudden said to me, I don't feel well. And she collapsed to the floor. I had just taken a CPR class. I tried to revive her, begged her to wake up, had to call 911, called my father at work. I'm an only child. And we lost her that day in that kitchen. She had hypertrophic cardiomyopathy. She was diagnosed in her 20s. And there was just nothing they could do. It was a side effect. And this is the early 90s before ICDs were present. Obviously, for me, once ICDs became something that was standard practice, I was offered that. And it was implanted in the early 2000s. It saved my life on multiple occasions. I ended up having children and was terrified that I had passed the genetic markers off to them. Every year they were tested because I was constantly asking, do they have a heart murmur? Can you listen to their heart? And I marched them to a pediatric cardiologist every year to check with echoes. Finally, when they were about 10 or 11, genetic testing became available to me and I took advantage of it. And luckily, neither of them had the genetic markers for HCM. That didn't stop my heart health, and I ended up having multiple surgeries, multiple ICDs placed, saved my life many times, and ultimately I needed a heart transplant. But I really want you to hear out of my story is that knowledge is power. If I hadn't known what to look for, if my mom hadn't taken me to her doctor, it could have been a totally different story for my family. So I just thank you so much for listening.
Allison, thank you. I can never listen to your story without getting chills. It's just so palpable, those moments that you had to endure and live with for the rest of your life. And I'm so glad that your story has a very different ending with lots of bonus days.
Thank
Got it in there. I got it in there. Okay. So I want to take Allison's story into somebody else's story and just talk about timing for a very quick minute here. This is a family tree. This is a pedigree. And the gentleman in the corner here with the glasses and the longer beard is the first person in this family that was diagnosed with HCM back in 2005. But they didn't understand what it meant to the family tree because they were given some misinformation from healthcare professionals. Most importantly, this is a male to male penetrance disease. That is not true. As you can see by Allison and myself, we both have had transplants from HCM and we're not men. So this is a disease that impacts everybody regardless of gender, ethnicity, where you live in the world. So this young man gets diagnosed with HCM, has surgery. His father goes on and has heart surgery, which we turn out to find out he had HCM, but had the wrong surgery at the wrong center and he died. His aunt then gets diagnosed with atrial fibrillation. And then his other aunt is diagnosed with atrial fibrillation and still told, this is Jillian's mom here, that this is a male to male disease. The AFib has nothing to do with HCM, when in fact it's part of it. So Jillian goes to the doctor for a well child examination in 21. It's clear. In 22, she goes back. They hear a murmur. When did this murmur show up? We go from murmur. Next month, we get echo EKG, checkup with an MRI. We get a diagnosis of clinical HCM. They send the genetic tests out to see if she has the same gene as her cousin. April 21st, 2022, the results come back. They find out she does carry the same gene. Now we're going to work on creating a treatment strategy for her. But unfortunately, we ran out of time because that very day, Jillian came home from school, learned the news that she carried the gene, walked up the stairs in her house and died. She was 17 years old. Had we gotten there earlier, a year, a month, a week even, we don't know what could have happened differently because we weren't given the opportunity of time. If we knew in 2005 that information should be shared with a family in a certain way, we would have done it. As soon as there was knowledge, there was action. We were just too late. We can't be too late for the next Jillian. We've got to get there in time. We've got to make sure doctors are looking for these family histories and asking the right questions. We're now going to hear from Noah to hear what you can do in the state of Pennsylvania to save the next Jillian. Noah, the floor is yours.
Lisa, I'm just so honored to have the opportunity to be here today and to hear the stories of Allison and Jillian. Dr. Wong, so impressed with the work that you've done. And I've just been incredibly impressed with HCMA and all the work that you do and how professionally organized you all are. I've had the pleasure of volunteering to assist HCMA and put together some model legislation over the legislative interim. And they did just such a fantastic job in putting together what states can do to help, because that's often the question of, well, what can we do to help? And in Pennsylvania, it really is the well child visits and being able to ask questions early, to be able to know in advance if children have HCM. And that all starts with the first questions that you're asked in the well child visit and the family history. A little bit of background, I've had the pleasure of working with states across the country, all 50 states for the last 23 years, and just sharing model solutions and best practices. So ideas that just make sense, ideas worth sharing and spreading. And to that end, we work on a lot of legislation that passes unanimously through chambers of the legislature, as was the case on the legislation in Virginia that we worked to introduce earlier this session. It passed the Senate 40-0 with bipartisan support and is on its way to passing on the House floor shortly. So there's a lot that can be done. Pennsylvania, like I said, it really is about those well child visits. This is a nonpartisan, bipartisan issue that we can all get behind. So for the supporters on the call, it's kind of incumbent upon us to reach out to our legislators to share the opportunity to work on model legislation to save children. For the legislators on the call, would love the opportunity to work with you. Again, volunteering our time to do what we can, because full disclosure, I have a colleague that lost a loved one to HCM, and that's how I got involved and learned about the association. Also was born with a heart murmur and have two daughters of my own. So we want to do whatever we can to help our children and be happy to work with you and assure that you have the support that you need to not only introduce a bill, but to work it through the legislative process and have the support of the folks that live in Pennsylvania to be able to express their story as much as Allison has to.
Noah, thank you very much. Julie is available for appointment, and you can use this QR code to set an appointment with Julie to learn more about our initiatives and how you can get involved. If you want to sponsor the legislation, if you want to know exactly what the language should be, Julie's the great starting point for that. I will open it up to questions, and we will use the Q&A field. If you have any questions, you can drop them there. While I am waiting for questions, I always have to put my thank you screen up. This doesn't happen in a silo. Our board, our staff, our volunteers, our partners, and our sponsors make all of this happen. And I personally would not be here if not for an organ donor, and her name was Brandy. So I like to invoke the concept of organ donation whenever I have the opportunity to speak. We also want to make sure that we say thank you to everybody who's helped us get here so far. So to those on the call, to those who are signing in or watching this after live telecast, we thank you for spending some time with us. So I'm going to go over to the Q&A. Excuse me. All right. So not seeing any questions yet. Allison, I'm going to riff with you for just a minute here. When you think about your journey with HCM and knowing about the diagnosis, have you ever had any conversations with friends who say, what is that? And should I get screened? Has it ever come up in conversation?
Yeah, definitely. I mean, I think that it's something that everybody sort of has in the back of their head. I mean, for me, obviously, I was kind of born into this, but I absolutely have friends who are like, I'm kind of like, they'll mention some symptoms that they're having, and I'm always like, hey, go get a test, right? It's not that hard to get an EKG, to talk to your physician, to say like, hey, do you think there needs to be further screening? So I'm always one to advocate. You need to advocate for yourself always.
More knowledge is good.
Yep.
Tim, Dr. Wong, is there anything that patients should be aware of as the trigger to want to meet a cardiologist? Because you guys aren't really scary. You're kind of nice guys. So, and girls, and we have a lot of them we have a lot of our centers of excellence in Pennsylvania. We have Europine Institution, we have UPenn, we have Hershey Med, and we have Allegheny. So if you have HCM and you're in Pennsylvania, you've got great coverage options. What should patients know?
So I think the biggest take-home message I'd like to share is really just to be aware of symptoms, where they may not be immediately connected with the heart. So things like just breathing funny or having some swelling in your feet. These may or may not be normal, and I really encourage folks to talk with their family physicians and get checked out. And then if there's any question, I think there's not a cardiologist in the state who wouldn't be happy to do further evaluation. And these tests are typically what we call non-invasive. They don't, they're imaging. There's very few needles and scalpels involved. And so I think the process should not be scary. And I think just don't be a stranger.
I would agree. An echocardiogram is not. It's not painful. It's a little annoying. The gel can get a little cold, but first world problems, we'll get over it. But knowing that you have a history to act upon, to listen to your kids when they say things like, I can't keep up. How come I'm the slowest one? I used to be so fast. Why am I not anymore? These are not necessarily signs of a child disinterested in physical activity. These could be indications that those individuals are not capable of performing at that level, and there could be a why. So talk to your pediatrician. And if we set up a system in which the law states that these questions should be asked, how they answer is, out of the hands of the physician. But if given an opportunity to share, I've had a murmur my whole life as the mother. I've had these symptoms, but I've never been diagnosed. Does that impact my child? That's a conversation to have with your chosen healthcare provider. And what you choose to do with that information is between you and them. So for anybody who is concerned over mandating a policy, we're asking for questions and conversation. We are not asking for a particular test or therapy because there's not one answer. If it's HCM, the answers are over here. If it's a possible anomalous coronary artery, the tests are going to look different, but that's up to the physician to talk about what these symptoms are, what they could mean clinically, and get them worked up. We can improve lives of those with HCM and other genetic diseases with enough knowledge to act upon. So we encourage you to enact the well-child inclusion of the PPE so that every child in Pennsylvania has the opportunity to discuss family heart health history and symptoms with their chosen provider. Please help us make this law and help us save some lives. All right, ladies and gentlemen, I thank you for joining us, and we have gotten this down to 25 minutes and fully informative. Thank you so much for joining us on this Heart Month episode of the Legislative Briefing for the State of Pennsylvania 2025. Thank you all.